As a provider, Dr. Weiner, how do you empower care partners and patients who have been diagnosed with AML?
From a provider standpoint, I think one of the most important things we need to do is listen, um, and try to understand, first of all, what the patient is going through and what the patient needs. And like I said, that's where this is a team approach. It's a team approach from not just the standpoint of patient and caregiver, patient and physician, patient and nurse practitioner or a physician's assistant, patient and social worker. This is a traumatic experience, and there are things that we can try to do to make it less traumatic. But one of the best ways to make it less traumatic is making sure patients are informed, that patients understand plans, patients understand what's going to be happening. The one of the biggest concerns with any of these diseases is the unknown. And there's a certain amount of unknown that I can't predict. I can't say to somebody, you will or will not respond. But what I can say is, listen, here is what we are going to be doing over these next few weeks. And here is our short-term plan, and here is our long-term plan, and making sure that we're all on the same roadmap. And I think that's really important in terms of empowering the patients. I think the other thing that's important is that the patients should feel comfortable asking questions, because we're not expecting our patients to be experts in leukemia. We're expecting our patients to be the patients. And I think of us in terms of the clinicians as being Sherpas. We're guiding people through this process, but the reality is they're doing all the work. We're just the guides. And so it's important as guides that we make sure all of these questions are answered and all of the information is given to the patient and that the patient asks for that information. And I think the other thing that's important is that I think is a little overlooked is taking care of the caregivers as well. So, you know, it's very difficult to be a patient, but it's also difficult to take care of a loved one or a friend during this time. And so it's important that the caregivers have adequate understanding as well about what's going on, what we expect to be coming forward in the next days and weeks so that they can plan for these processes as well.